So throughout this video, I'm going to be talking about my method for treating acne on an online sense. So I've helped many different clients help to heal their acne and other skin conditions in an online capacity. So I'm going to be talking about my services and just talking about how I do this. Hello souls, my name is Kathleen and I'm the owner and lead therapist here at Soul Awaken Skin Therapies. I am a holistic skin therapist and here in my clinic based in Adelaide, South Australia in the little beach suburb of Glenelg, I specialise in treating the skin condition acne. I am so passionate about helping you to heal from this skin condition. So that's why I've dedicated this whole YouTube channel to helping you. So please, if you're enjoying this channel, definitely consider subscribing and also consider hitting the little bell icon so you can be notified when I post new videos. And of course, pop your comments in the comment section below because I really love to hear from you and I would love to get some video topic ideas. At the end of the day, the reason why I'm here is to serve you, so please do utilize that. In today's video, I'm really excited to be talking about how you can start to heal your acne from home. Yes, that's exactly it. You're going to be able to learn how to treat your acne from home without professional treatments. Now, before I kind of delve even more into this topic, I just want to clear up and just say this might not be possible for all acne cases. There are inflammatory grades of acne and non-inflammatory. So this video really does target the non-inflammatory side of acne or comedonal acne. And also this video really does more so apply to those cases of acne where it's more of a topical external case of acne rather than an internally driven one. So please definitely take the points from this video and consider how you can start applying them to your skin. If you find that it's just not enough information or you need more guidance, please do not hesitate to seek the professional guidance of a doctor, a dermatologist, or a licensed and trained professional skin therapist such as myself. But before we get into today's video, I would like to remind you to go and follow me on over Instagram and Facebook. I'll pop my tag here, and if you go on over there, you can expect to see lots of educational content, not only on the skin condition acne, but also content to help you with your skin in general, so you can have the healthiest and happiest skin possible. So in today's video, I'm going to be talking about the skincare interventions that you can make to start treating your acne from home. But as mentioned at the start of this video, it really is so important that you do seek the counsel and guidance of a professionally trained medical professional such as a GP, a dermatologist, or a skin therapist, someone who is specifically trained in the area of acne. And the reason why I say this, and I really do encourage you to go down this route, is because you might potentially be misdiagnosing your skin. You might believe that you have acne, but you may have other skin manifestations on your skin at the same time. As a holistic skin therapist with my own skin clinic, I have seen so many different cases of acne. I've seen inflammatory acne and non-inflammatory, different grades within that. And also I've seen acne manifest with other skin conditions. Just to name some of them, I've seen keratosis pilaris on the cheeks, I've seen perioral dermatitis, I've seen staph infections on the skin, and I've also seen different degrees of an impaired skin barrier. So there are just so many factors to consider, and although all the information in this video is really useful, you might just want to seek the guidance of a professional, not only to help you with your topical environment and to really kind of help you guide you along this journey, but you also want someone who is understanding of the holistic side. So they want to be able to look at you as a whole, because at the end of the day, we know that in a lot of cases, acne is internally driven, whether that be your hormones, your gut health, your stress response, or your nervous system. So you really want to dive a little bit deeper. It could also be to do with adrenals or your thyroid. So please do consider getting that help, whether that be a naturopath or someone such as myself. So the whole point of this video was so you can actually start to heal your acne at home. I want to drive the point home and say that there is actually a lot of therapists that are now more available online, particularly after 2020 and COVID. You all know the deal. Everyone has really started to adapt and bring themselves online. I myself, as someone who has really started to make myself more and more available, I have already been providing online consultations. I also have a naturopath that I love to recommend who is also available online. So that's just, that's her and I are both really trained, really specialized in treating skin. And that's just two examples of people that you can lean on. And you don't need to be in Adelaide, South Australia. You can essentially be anywhere in Australia or potentially around the world. So please definitely consider looking into therapists online if you can't find a good professional in your local area. Because at the end of the day, you really want to find someone who is highly skilled, highly trained, specialized, and probably the most important point, you really want to be able to relate well to them. You want to be able to feel that connection where you feel like you're being heard, your points are being addressed, and you are in good hands. So please definitely do that. Don't just go to the first person you see. Really do some research and consider, if you need to, go online and find these professionals. I really hope that helps, because there's so many of us out there just that are so willing and happy to help you. All right, so now that point has been driven home, I want to let you know about the skincare recommendations. So throughout this video, I'm going to be talking about my method for treating acne on an online sense. So I've helped many different clients help to heal their acne and other skin conditions in an online capacity. So I'm going to be talking about my services and just talking about how I do this, but you might find that other professionals do this in a slightly different way. So to begin with, you want to make sure that you're getting some sort of professional treatment for your skin. So here in my clinic, the way that I look after my acne clients is through a series of skin treatments. So I get them in for customized skin treatments. So they usually consist of an enzyme peel or an enzyme mask is probably a better way for it. So these enzymes work really, really gently to kind of break down the excess corneocytes that are kind of still left on the skin that are creating plugs and creating more inflammation and acne essentially in the skin. So I use this enzyme treatment, and I also combine this with a customized leave-on mask. And this is the basis of my level 1 skin treatment in my clinic at the moment. And this is actually something that I've been able to transform into a take-home treatment. So I'm so proud of it. And every single person who purchased this DIY skin treatment actually has their treatment completely customized. I provide a video that you get sent to your email so you can follow it step by step. You can watch the video, you can read the instructions. It's all pretty simple. So that's amazing. And I love that I've been able to take that and deliver it to a home care so you can do it at home. You don't actually physically have to come and see me. So that's a really good win, and that's something that I would recommend to help treat your acne. So essentially, you're also going to want regular online consultations with your therapist. So if you're seeing me for online consultations, you'd want to be booking in at least every 4 to 6 weeks. That's how you're going to get the best results, because sooner is okay. If I saw you every 2 weeks, that would be wonderful, and I'd really look forward to that. But I would also say that it might be a little bit too soon to actually start to monitor results, but it really depends on your case. But I would say somewhere between 4 and 6 weeks is a good time for me to be able to monitor your changes, implement new bits and pieces to your whole routine. So just consider having regular online consultations if you're wanting to go down this route. The next thing is you're going to need a really good customized, active, and bespoke skincare routine to suit your skin. So again, that is something I do for my clients. So I don't just pick products off of the shelf. I actually customize products to suit that person's skin. So there are a plethora of different anti-acne ingredients that are not only going to help with acne, but they actually have other different benefits in the skin. So I would highly recommend, if you're going to see someone, go to someone who is specialized and understands how to treat acne. But if you're coming to see me, I'd be including some of the following ingredients, such as azelaic acid. I would be using vitamin B3, so niacinamide, probably D-panthenol, panthenol. Definitely be getting some vitamin A as well into your routine. Definitely be leaning on some salicylic acid. Zinc is definitely a must-have. I rely on green tea a lot in my clinic as well. I might also recommend ingredients such as vitamin E, vitamin C, and honestly many others. It really just depends on your skin and your internal triggers, and really how I look at your skin and what I think that you need the most of. So all of these ingredients can be found in serums and moisturizers, and I would also prescribe you a gentle pH balanced cleanser that's not stripping your skin. Something that's cleansing your skin gently, but it's also not over nourishing it at the same time. And also skincare that is helping to repair the barrier, reduce inflammation, also has capabilities of reducing 5-alpha reductase. It also has capabilities of increasing cellular turnover, helping to treat an impaired enzyme activity, as well as treating incomplete corneocyte compaction and anything else that's kind of going wrong in the skin. Another thing that you can do from home in terms of skincare interventions is to actually bring in a at-home skin needling device. And I do this for pretty much all of my acne clients that come to see me in clinic, but you can also do it for at home as well, of course, because this at-home skin needling device is an at-home one, and I actually send through a video with lots of different instructions so you can actually do it at home. And what this skin needling device will do, it'll do a lot of things, but there's two main reasons for it, and we can only bring it into your routine at the correct time. So first of all, it's going to release growth factors into the skin, and these lovely little growth factors, they basically help to reduce congestion in the skin. There's a specific growth factor that helps with congestion. So that's fantastic, especially to help with non-inflammatory acne. So things like comedones and blackheads, you know, there's little bumps in the skin, kind of congestion, that can be really good for that once your skin barrier is functioning and you've got the right ingredients in your skin. This at-home skin needling device can also help with post-inflammatory hyperpigmentation, which is going to result when you do have pustules happening on the skin. Generally, if you have non-inflammatory acne, you don't tend to get much post-inflammatory hyperpigmentation or acne scars or dark marks is another word for it. But still using an at-home roller is also really, really effective for non-inflammatory acne. So that is absolutely something that you can implement. So this is what the at-home skin needling device looks like. This is the MTS roller, and this is a very good and reliable brand by MTS, and this is a 0.3 mils rolling device, and this is the one that I recommend. I do actually recommend that you be very, very careful with the brand that you decide to go with, because it's really, really common for these devices to be made cheaply and in bad manufacturing processes. These little tiny needles are going into your skin. If they're not clean, then that's not a good thing. If they have splinters, that is a very bad thing. If they're the wrong depth, that is also a really bad thing for your skin. So these are only 0.3 mils, and generally that's really good for most clients. So I do recommend, do really good research before you buy one of these. I've seen so many of these being sold with really long needles, very barbaric looking, and I don't recommend that. That could be actually more harmful than good. So moving on, we also want to start to look topically as well, because this is something you can do at home, and you can do a little bit of Googling, but if you'd like me to do a full video on this, I'd be very happy to, and that is to definitely consider the makeup that you're wearing on a daily basis, and what makeup is potentially acne safe or acne hindering. So you want to go through your whole routine and you want to switch your makeup over to mineral makeup. And there are certain ingredients that for some people, they tend to be a little bit inflammatory for acne. So you want to be able to formulate an acne safe makeup routine, especially if you're wearing makeup on the daily basis. So moving on to internal factors, you also want to start to look at all of the factors underlying acne, and that could be driving your case of acne or comedones in the skin. And that list is pretty extensive, but I'm going to list a couple of them that you could absolutely start looking at and researching and doing a little bit of at-home work to start improving not only your skin, but your internal health status as well. So the first one on my list is sleep. Oh, it's so important. I have so many clients that report to me and they say that they're not stressed, they feel really good on a day-to-day basis. But when I go to ask them about their sleep, they're like, oh, I just really struggle to sleep. When I hear that, the first thing that comes to mind is, well, absolutely, if your sleep is disturbed, you are having an increase in inflammation, and you're also getting a rise in stress hormones, which is also increasing inflammation, which is also disrupting your stress hormones, which again is affecting your sleep. So it's this little vicious cycle. So that is something that you can definitely start thinking about. So you want to think about things such as your sleep hygiene. That's definitely a whole nother topic. If you just go onto YouTube where you are right now and actually look up different sleep experts, there's so many books out there and really educated people talking about sleep. So get the right amount of sleep. Make sure you're doing all your sleep hygiene, such as wearing blue light glasses or just staying away from screens before bedtime, and really taking time to wind down. Consider meditation, drink lots of water, herbal tea is really good. So there's just so many things you can do. And sleep it seems like it's such a little thing, but it really can make a big difference. And while you're there, consider changing your pillowcases quite frequently when you have acne, because that's just another little thing that you can do, as well as taking your hair away from your face when you're sleeping. Because if you're someone that kind of rolls around and your head's going everywhere, you have products in your hair, they're kind of moving onto your face, or you don't wash your hair that often, which is totally okay, but you could be having oils and products sitting in your hair and then moving onto your face, which is also exacerbating acne. Another factor that you can start to work on at home is your diet. So I've kind of spoken about this in other videos, and I'm very happy to do a whole dedicated video on this. Just let me know down below. But that is to look in your diet. So there are a couple of little food groups that you do want to start really thinking about. And one of them is dairy. So we want to reduce dairy. We don't want to cut it out altogether, because you really need to speak to your nutritionist and your doctor to make sure if that is safe for you. Of course, you've got to do your due diligence, but if you can safely reduce your dairy or even cut it out altogether, that's more than likely going to have a really good effect. It is pretty well documented that milk does tend to have a negative effect on acne, as well as things like whey protein, which is also from dairy. So just consider reducing that and speaking to someone about cutting it out. Dairy is also inflammatory, so that's also something to consider, since acne generally has an inflammatory component to it. You also want to consider reducing your refined sugars. So that means all of your white tablespoon sugars and raw sugars. It also means sugar that's found in processed foods. It could also mean reducing your refined carbohydrates, which when taken into the body convert into sugar. So such as white pasta, white rice, white bread, they can all be refined carbohydrates that can actually be driving your acne as well. So please do consider reducing those as well. You might also want to look into increasing your good EFAs, so your essential fatty acids or omega-3s. That's also something to consider, and definitely talk to your naturopath or nutritionist or doctor about that as well. In another video, I spoke about this in greater detail, so definitely check it up here. I talk about the 3 aggravating factors of acne and how you can use that information to start healing your acne. You might also want to start looking at your stress response. This is really important. I've hinted at it a lot in this video, but stress and sleep and nutritional deficiencies, it all works in together. And if you have hormonal imbalances, there's probably going to be a heightened amount of stress or stress hormones running in your body. Potentially, if you have gut health issues as well, we could also have heightened cortisol and stress levels in your body. And of course, if you're suffering from acne, there is also the potential that you're having that psychological discomfort that's also creating a stress response in your body. So this is an area that really does take a lot of guidance. You might want to seek the counsel of maybe a psychologist or some sort of trained counselor to kind of help you in this area, especially if you're struggling mentally. I really do recommend that. It's not nice. I've been there. I've not sought help for a time, and it's not easy. And what I mean by that, it's not easy. It's not easy to suffer in that pain and not see someone, because as soon as you see someone, things really do get easier. So please do not neglect to seek psychological counsel and get some help to start reducing your stress levels, because that absolutely has an effect on acne. And you can also start to look at your lifestyle factors. So things like sweat and exercise. So are you exercising in the morning and potentially not cleansing your skin straight after, because that could be actually leading to more comedones or pustules or pimples on the skin. Things like this can really come into play. So if you'd like a full video on all the lifestyle factors that could potentially be aggravating your acne, then definitely comment below and let me know. But there are definitely more to consider. Things such as drinking alcohol, taking recreational drugs. There's so many really unique factors. One that comes to mind is actually people that, I don't have a desk here, but what they'll do, they'll kind of sit like this when they're at school or at work, and just this friction and sweat that's increased through their hands around their mouth and their chin, it actually can help to create more acne lesions. It can also be caused from face masks as well. It's a whole new thing that we're dealing with in 2020. Because of how prevalent this mask acne has become, they've actually given it its own name. It's called maskne. So there you go. That's just another example of how sweat, dirt, debris, and makeup and friction in the skin can actually promote the formation of comedones and pustules and papules in the skin. All right, souls, I have given you so many tips today, and the most important thing that I really want you to get out of today is to feel empowered to actually make a lot of good changes to your health, to your skin, at home. You actually don't need to have a professional skin clinic near you. I have helped lots of clients from home treat their skin with modalities such as the skin needling, such as the prescribed bespoke skincare routine, such as doing all the internal work that I mentioned as well. So please definitely take that on board and really start to look at all these areas just one by one. You don't want to go too deep into it and start to feel really overwhelmed. Just jump in there, do one thing at a time, and just start to improve your overall wellness, and definitely seek the guidance of somebody who is trained and specializes in treating this condition. Thank you so much for being here with me, souls. I really hope you enjoyed today's video, and I look forward to seeing you here next week. Bye.